Hello, good people. Dr. Lewis here. Welcome to the channel that enlightens you on healthy living on the daily. Now, today we are tackling a topic that most people shy away from talking about, even though it affects millions of people around the globe. It's not one of the topics that you can raise or that pops up around your dinner table because of the shame that comes with it. But we all know of the effects that those symptoms, the uncomfortable, the painful, the swollen blood vessels in and around your rectum or your anal area can bring. And even the pain that comes when passing stool, the fresh blood in stool, etc. So shy not, because today we got you to this. We are going to handle a topic that is called hemorrhoids, how to prevent it, how to manage it, and also how to cope with the symptoms of hemorrhoids. Coming up. So on the board, I have tried as much as possible to draw the structure that will represent our small intestine and our large intestines. Now, hemorrhoids occur around the rectal area. So this is our anal area, this anus, the anal opening, this is the rectum, and this is the large intestine. Now I want you to understand that we have different types of hemorrhoids, and number one hemorrhoids is the internal hemorrhoids. So what are the hemorrhoids? First of all, before we even start tackling this, let us try and understand that around this rectal area, we have a very rich blood supply. Okay, so we have this intercrossing blood supply on blood vessels or capillaries that supply this anal and rectal area. And once they form that interchange, that is what we call the plexus. And that plexus is named hemorrhoidal plexus, okay? So this is where the problem begins. So any pressure that is exerted on this hemorrhoidal plexus can yield symptoms of swelling or painful pain when you're passing stool. Now, sometimes these blood vessels get to swell, and once they swell, they form some sac which accumulate blood. Now that blood, one, you can get an infection from that. Number two, when you're passing stool, then you might end up rupturing that sac. And that's the reason why when you have hemorrhoids, your stool has fresh blood, because this blood is just from the rectal area. If it's from the gut, then it will be dark colored stool. But since it's from the rectal area, then the stool comes out with fresh blood. Okay, and that's one of the symptoms of hemorrhoids. Then it becomes very painful, and at some point when you got this being open, you can get bacteria. Remember, bacteria reside in the large intestine and in the colon. So they break down food here. So there's a large population of bacteria in this colon, and therefore, when you rupture these sacs and they become open, bacteria can get through that into the bloodstream and therefore start causing you bacteremia or bacterial blood infections. Okay, so it's high time that you take cautions about this, because it's a condition that definitely brings a lot of issues when you're passing stool. Okay, so the internal hemorrhoids, I want you to know that these are way deeper. So you might have them deeper into the rectal area, and once they happen here, sometimes they don't even show the symptoms, so it's not painful, and they can disappear on their own. However, when they come to the external hemorrhoids, which are near the anal region, that is where the problem comes in, because now here, when you pass stool, you get to rupture this, and they are inflamed, remember. So they are causing a lot of itching, they are causing a lot of inflammation and pain, and when you pass stool, you start feeling that pain, and these are the ones that rupture. Now also understand that as you head outside the anus towards the external, then sometimes your rectal tissue can pop out of the anus and fail to go back. So once it pops out and this happens, then that's what we call prolapse. Okay, and prolapse is just basically the rectal tissue popping out of the anus, and then it starts producing a lot of mucus, and this mucus is a little itchy, and you get a lot of problems anytime you sit for a long period of time, anytime you walk for a long period of time, or anytime you're exercising, or even pooping. Okay, so those are the three factors, those are the three examples of hemorrhoids. Now, hemorrhoids, the basic reason why they come to happen is not even known. So most treatments that happen here are just to help you cope up with the symptoms and possibly dietary modifications so that this can disappear. So we'll talk about those dietary modifications. However, If this starts happening, then you feel that pain, the only solution is, one, you have to fix the diet, and two, you have to go for the drugs. And most of you have been given those drugs for hemorrhoids, the suppositories that you insert in your rectum to help you kill the pain or just soothe the rectal area. Some of you have been given those laxatives, those drugs that help you soften or bulk your stool so that it gets out easily. However, nobody takes time to talk to you about what are the procedures that you're supposed to do, how you should lead your lifestyle, how you should reduce the pressure that comes as a result of the effects that come as a result of exerting pressure on the hemorrhoidal plexus. Now remember, anything that exerts pressure on this plexus or that blood vessel network, that is one reason, that is an exposing reason for you to getting hemorrhoids. Okay, so anything that brings pressure to this, be it the exercises, heavy lifting, be it the diet, be it constipation, be it sitting positions and pooping positions, all this can exert pressure to this plexus and cause you hemorrhoids. And that means we'll have to reverse that. Once we reverse that, then the hemorrhoids start to disappear. Now, what are the risk factors in hemorrhoids? So remember, all these factors that are considered as the risk factors, once you change them, you can easily survive your hemorrhoids. Number one has to be obesity. So basically, number one reason why you should start losing that weight is because of this. Once you're obese, then this is a very high risk factor for that. Then you also have constipation, and that means you're basically overfeeding your bacteria in the gut. And once you overfeed them, they do not have a chance to now help you break down the fiber that makes your stool so hard and so bulk. And then you start getting into constipation. And this can easily rupture those blood vessels in the rectum. Then we have low fiber diet, of course, definitely. Then we have the anal sex. So those people who are involved in anal sex, let us leave the exit for exit. Okay, so anal sex can expose or can stretch your hemorrhoidal plexus and your rectal muscles, and that exposes you to hemorrhoids. Then above all, straining while pooping. Now, most of us have become so civilized to an extent that you have sitting toilets. I am not saying that sitting toilets are a problem. I'm saying if you have a sitting toilet, then you need to maintain a certain posture on that toilet for you to pass stool with ease. Because most of you get into the toilet, you sit, you start straining to pass stool, so you start exerting pressure on the hemorrhoidal plexus and the rectal muscles. So therefore, the best way or the best position for pooping has to be squatting. Now, squatting is the natural pooping position because there is a muscle here that holds on to your rectum, and anytime you sit, it's like it pulls your rectum in that position. Then the rectum takes this position. So that means it will be hard for you to pass stool through this curve. So that muscle definitely comes in and pulls out the rectum towards that direction. So it becomes so hard for you to pass stool. And that's why squatting is the best position, because once you squat, this rectum goes back into its normal position, and therefore you can easily pass stool in that position. And therefore, if you are sitting on that toilet, then you have to make sure you assume the squatting position, which means you sit, and then you can have maybe a small stool that you put on your legs, and you assume the squatting position in that toilet. So that will help you pass your stool with a lot of ease. So those are basically the risk factors. Now, if you have these risk factors, if you are obese, if you're always in the toilet, taking so much time in the toilet, reading a novel or reading a book in the toilet, you're supposed to only spend a limited time in the toilet. Just go there, deposit what you have to deposit, and walk out. Don't go there and start reading a novel or a journal. If you're involved in anal sex, if your diet is low in fiber, low in vegetable, then of course you start to experience this. If you're an alcoholic and if you experience constipation all the time, regardless of the cause of that constipation, you are risking hemorrhoids. Now, so what would you do, or what do you do if at all you have hemorrhoids and you want to heal from them? Remember, they do not have a cause, but we have the risk factors. So number one on this has to be, the risk factors have to go. Once these go, if you're involved in heavy lifting, do not go to the gym and be involved in ego lifting. Don't lift what you cannot handle. Go to the gym and train your body as per the goals that you want to, and then lift progressively, increase progressively. Don't go there and carry to just please people. That is ego lifting, and it can lead you to hemorrhoids, if not also hernia. Okay, then after that, start concentrating on high fiber diet. Just increase your fiber diet, your vegetables, your complex carbohydrates. Increase that in your diet so that you help yourself have a bulk stool and then pass it out. Now, water, you take water. Now, you've heard, if you have constipation, most doctors will tell you that you have to drink water. Now, I want to correct that, because drinking just water is not enough. Actually, that water is not just going into the rectum to dilute stool and make it soft. That is not what happens. Your gut will absorb that water, goes into the system, and then maybe it might end up getting out through the urine and the kidneys. So what we are doing is, the reason why we are adding salt to that water is, one, you need to be hydrated, and salt will help you absorb most of the water. Number two, salt will activate the rectal muscles to move in their normal peristaltic movements. So once it does that, then you can easily expel stool with a lot of ease. And therefore, just add a pinch of salt in your drinking water so that you activate the gut for breakdown of those proteins, so you don't have constipation. Also to activate the muscle of the rectum to get that peristaltic movement that will push out the stool. Then exercise. Of course, exercise fixes obesity. Exercise is also important for your rectal muscles. You strengthen your rectal muscles. However, do not do ego lifting. Okay? Then weight. Of course, weight has to go because of obesity. Once you drop that, you recover. Pooping position, we already agreed that the best pooping position, or the natural one, is squatting. If not, assume the squatting position. Then hygiene. Most of you know that the rectal area is high in bacteria, and that's the reason why you get that infection. So it is high in bacteria concentration. How do you beat that? When you have these hemorrhoids, you need some soothing. If you're not using the suppositories to soothe, then you can use warm water. You sit on a basin that has warm water so that it soothes the anal area. Then maintain the hygiene of the anal area, because again, this is a risk factor. So once you maintain that hygiene, you start recovering from it. For drugs, specifically go for painkillers like paracetamol. Do not be involved in NSAIDs that will cause more inflammation to your gut and your rectum. So go for paracetamol or even the suppositories that are prescribed by doctors. Then I want you to know, once this happens and these sacs have blood already, the only option that we have here is, if it's hard to manage, then the doctors will recommend surgical removal of this, those sacs, okay? So once you remove that, then again you have to prevent infection and treat. If there is infection already, treat for infection with antibacterial agents and hygiene. So that is how you handle hemorrhoids. I want you to also know that preventive therapy is more important than curative therapy in this. So preventive therapy will involve fixing the diet. And what types of diet do you eat? We have always been against diets that are rich in wheat products. We also have a problem with diets that are rich in sugar. So these are the types of diets that definitely, one, will lower immunity, and two, they are highly inflammatory, systemic inflammation. So remember, hemorrhoids can just be one of the issues of the rectum, but also we have inflammatory bowel syndrome. So IBS, we have diverticulus. We have all these conditions that affect the rectum, and they can easily be fixed by fixing your diet. So if you want to fix hemorrhoids, do not just focus on the hemorrhoids alone. That is just a sign that you are already having a messed up diet. We have put up a lot of videos that are talking about what you should eat, avoiding seed oils, avoiding sugar, avoiding wheat products, avoiding drugs, okay? And being hygienic, avoiding all these inflammatory foods and consuming foods that are healthy for you, healthy keto diets, carnivore diets. So we advocate for that because this is what will fix your gut. And once it fixes your gut, once you will not go into obesity, you will not go into constipation, you will not go into low fiber diet. And once you do that, then of course you fix the causes or the risk factors for hemorrhoids. Okay, so this is a very easy condition to prevent. And if it has already happened, then of course you just have to understand, you reverse what you're doing. If you're doing the wrong thing, the wrong diets, if you're doing the wrong exercise, they have to go. And then once that happens, they disappear. The internal hemorrhoids disappear on their own. That's the best thing about them. They can disappear on their own once you fix your diet and you fix your exercise. So that is all about hemorrhoids.